like to thank all of you all for joining us and for the coverage that you provided so far. As this pandemic continues to evolve and community spread has been established in many of our neighboring communities, the who, when, where, and hows of each individual case are becoming much less critical. Local, provincial, and national orders and recommendations are illustrating that we have to assume an individual can catch this illness anywhere at this point in time. That's why it's extremely important that residents are staying home, physical distancing where possible, and following other public health guidance. I also want to assure the public through our case and contact management process, we continue to follow up on any case reported to the health unit, test or no test. This means we're also contacting any individual that has had close contact with a confirmed case. If a confirmed case presents a significant risk to the public that would make it difficult for us to identify close contacts, we'll release that information widely.
Thanks, Dr. Urbantke. I'll now open things up for questions.
Can I just ask if Dr. Urbantke's statement can be sent to us by email?
Sure.
Okay.
Did you, who was this? Sorry, so I can follow up with
Sorry. It's Michelle Ruby from the Expositor.
Okay, no problem, Michelle.
Thank you.
Could you send it? Yeah, me too. Air News.
I'll send it to them, no problem.
Yeah, and the Turtle Island News as well. Thank you.
If I may, Dr. Urbantke, can you tell us a little bit more about patient number 4?
Yes, I can speak just briefly about the fourth case. This individual is a man in his 50s who was a close contact of another previously confirmed case. He is currently hospitalized in stable condition.
Is he on a ventilator?
Unfortunately, I can't disclose anything more due to privacy.
Okay, that's fair.
Is Brant County including any Six Nations members in its numbers?
No, the Brant County Health Unit covers the county of Brant and the city of Brantford. The Six Nations does have its own public health unit.
Okay, so I just wanted to clarify that if any cases were positive on Six Nations, they wouldn't be counted to the Brant County Public Health Unit?
That is correct.
Okay.
How many people in Brantford and Brant County have been tested so far?
Testing occurs through the Brant Community Health System. As of yesterday morning, they reported to us that 309 people had been tested so far. We're partnering with them to get numbers posted on a weekly basis for the community.
How quickly are people getting their test results?
It does vary. Unfortunately, there is a large backlog in testing at the laboratories. Testing is prioritized for certain populations, especially healthcare workers and residents of long-term care facilities as such, and hospitalized patients.
Okay. So it's taking, are you able to tell me how long it's taking for local test results to come back?
For outpatients, we have seen weeks, wait up to a week.
Up to a week?
Yeah.
Okay. And it's sooner for those who are in hospital?
As more and more testing center comes online, as I said, they are prioritizing the high-risk populations, hospitalized patients, long-term care residents, and hospital workers, or healthcare workers, I should say.
Do we have enough test kits? I think there was a shortage, or are there more? How is the supply of testing?
I can't tell you. We don't test here at the health unit. The hospital is that's where testing is through. Certainly, if we obtain any supplies, we pass them on to the hospital immediately to to facilitate their testing.
Okay.
Now, I know the Brant County paramedics are appealing for donations of personal protective equipment like gloves and face masks. Is there a shortage of that?
You would have to ask the hospital and about personal protective equipment, supplies, etc. I believe all those donations are being handled through the hospital foundation.
What is the role of the Brant County Health Unit when it comes to Six Nations? What role are you taking here?
So certainly Six Nations has its own public health unit. We do liaise with them. And as you may have known, that there is a virtual joint EOC going on between including the city of Brantford, the county of Brant, and also Six Nations sits at that table. So there is a lot of interaction and communication between the groups.
I think you mentioned tracking people who have come in contact with those who have tested positive. Can you elaborate on that a little more? How is that done?
The part of case and contact management is interviewing the case themselves, household contacts, family, and working through any person that they may have had close contact with over the time that they possibly had symptoms or were be able to infect other people.
Now, I know some people who live in apartment buildings are a little concerned that some of those who have been tested positive or who are probable cases might live in apartment buildings. Are there fears? Are there fears? Like, is it going a little too far? Is it easy to spread in an apartment building, especially in elevators, or is it unfounded?
So certainly the big things, everything is the hand washing. So if you're out in a public spot, immediately after washing your hands, cleaning high touch surfaces like doorknobs, elevator keys, using your good old elbow for pushing elevator buttons are all strategies for reducing the spread when you're out and about.
Just to follow up on that, I know that there are privacy issues involved, but say if someone tests positive who does live in an apartment building, would other people who live there, other residents, necessarily be told about that, or is that not happening?
So the people who test positive would self-isolate. In addition, the degree of contact is between people is evaluated, and people are contacted based on risk level.
Dr. Urbantke, are you able to comment on the the emergency alert that was issued about an hour ago?
No, sorry. I was in the middle of a teleconference when that occurred. I just heard it, and I will admit I actually haven't read it yet. Yeah, all those have been cleared.
All of those have been cleared, okay. And there was only one who tested positive out of those 25?
None of our confirmed cases were.
Do you have concerns that people who are suffering from other illnesses or and perhaps are apprehensive to go to the hospital? What would you say to them? Do you encourage people to continue to come to the hospital?
If people require medical attention for other reasons other than COVID-19, they should follow their usual routines, trying to contact their primary health care provider, or if they see a specialist for any reason, they could try to reach out to them. There's been many ways that have been developed over the past few weeks for those in offices to see and evaluate, assess people virtually or via telephone. Certainly, if patients require acute medical care where they would normally have to attend the emergency department, such as a heart attack or something, they still certainly should be attending the emergency department or calling 911 if required.
Okay.
So when I'm out and about in the community, it certainly looks to me like the majority of people are taking this seriously and social distancing, and I would thank all those who are doing that in our community. I do hear occasional reports of small groups together, but I'm also told with some education these groups seem to disperse. So we have had enforcement officers go around and review establishments that should be closed under the order from the province, and all of these appear to have complied. And once again, in the early days, a bit of education, and they complied with the orders.
What are the risks right now for anybody going out to get groceries? What are the risks of grocery shopping right now?
I think once again you have to use the common sense and do the usual, making sure you're washing your hands before and after you're out, avoiding touching your face. And while you're in the store or near others, social distancing.
Well, people are saying that you're supposed to wipe down all your containers when you come home from grocery shopping. Is that necessary?
I haven't seen any evidence brief on that, but certainly if people want to act out of the abundance of caution, it's not unreasonable.
So is there a chance or a risk of getting the virus, though, by being in the same grocery store as somebody who has it in, like, the next aisle over to you, or, you know what I mean? What are the risks associated? It just seems like people keep talking about social distancing and physical distancing. Even outdoors, they're asking people to do this, but yet grocery stores are still open and people are crammed inside grocery stores together. I just think that's kind of a risky place to be right now.
Certainly, I believe grocery stores have enabled a number of different mechanisms to get food and that. As I said, people should take care to be doing their 6 feet separation while in the stores. The spread of COVID has been shown through droplet contact, which is about is at the 6 feet measurement, and so that's why we recommend that social distancing or physical distancing of 6 feet.
Hello. Could I ask a question about the Quarantine Act? Because according to the Quarantine Act that was passed yesterday, if you've tested positive for COVID, you cannot be in public. So my question was, has Brant Health Unit been contacted by the federal government about enforcing the Quarantine Act?
So anyone who is tested positive should be in self-isolation, and we do daily check-ins with people.
Right. So the federal government hasn't been in contact with Brant about the concerning the Quarantine Act, because according to that, if you were out in public with COVID, you could be charged.
I have had no direct communications with the federal government.
Okay, all right, thank you.
I wanted to ask a question from a health perspective. There's been a lot of talk of increased risk for severe illness in people with so-called pre-existing health conditions. Now, a lot of those conditions have been listed as people with, weakened immune systems, people on immunosuppressive drugs, people, with diabetes or cancer, other sorts of illnesses. But I haven't really heard anybody talking about cigarette smoking, and there are a lot of smokers in our country, and even within Brantford-Brant County and Six Nations. Is cigarette smoking considered a risk factor in developing a severe form of the illness?
Certainly, I haven't seen the cigarette smoking specifically listed. However, given that COVID attacks the lungs and cigarette smoking does affect the ability of the lungs to be healthy, it would make sense that cigarette smoking would potentially contribute to worsening disease in a COVID person.
So what advice do you have for smokers right now?
Advice I would always have for smokers is that I know it's difficult, but quitting is the best solution for health overall.